Hello, friends. It's Monica, also known as Sleep After 60, and I'm here for my week 37, 38 update post VSG. Today is Sunday, December 3rd, which is my 9-month wedding anniversary, and I'm coming to you for week 37, kind of 37, 38 update. I am deep in maintenance. So, quickly, I have a lot to say, not too much time today. So, quickly, I had VSG, which is some people call it the sleeve, on March 14th, 2017, at Fairview Hospital, University of Minnesota, in the Twin Cities, with Dr. Daniel Leslie. At the time, at my heaviest this century was 240 pounds. I actually, is that true? Was it 257? I can't remember. But anyway, 240 is kind of what I recall 2 years ago when I retired from work. And when I started with the university, which was in November 2016, I was 224. Day of surgery was 198. And I did not have a goal weight. My doctor didn't do that, but I pretty much, I reached normal weight BMI, a normal BMI. I think that's a better way of putting it, at month 6. So that was about 3 months ago. And I've pretty much, actually, last month, for some reason, I think I traveled and I lost like 5 pounds or something. And this month, I think I lost like a pound or two the whole month. And I'm fine with that. I feel like I'm right under 5'5", right under 5'5", and I will be 65 in May. So I feel that 140 pounds or 130 some pounds is just fine. And I'm a solid size 4. I do have some jeans that are size 2, but size 4, pretty much across the board, different brands that I've bought, I'm able to fit into, except for Zara. What's with Zara? Those are really skinny sizes, aren't they? But anyhow, so things are going well. But here's my big news. Tomorrow, which is the 4th of December, 2017, I'm having plastic surgery. I'm having a why can't I say that word? Brachioplasty. I'm having a arm lift. Mine is called, I think, a lateral, because there will be the cut will go down both sides, and then he's going right under my arm. He'll be making kind of a tuck, and I will not be having any implants. I have tiny little breasts that I am very happy to have. I had many years ago, when I turned 50, I had a breast lift and breast reduction. So I love clothes and I love fashion, and I sort of like the idea of having very small breasts, because I'm able to pretty much wear anything I want. I'm perfectly happy with my old lady little breast. So tomorrow, and what does that mean? I had kind of a frightening sort of few weeks when I went to OH in Long Beach. I had this incident where my left foot fell asleep and it wouldn't kind of wake up. My foot was really flappy. I wasn't able to wear high heel shoes. And I thought that maybe it has something to do with the fact that I don't take a lot of extra vitamins. And so I thought maybe it has something to do with that, or it had to do with my back, because I do have some back issues. Came back and went to my doctor, had a full checkup, and had work had I want to say chemotherapy. I didn't. God no, I had blood work done to see what my numbers were, and everything was was normal and doing great. And then I had an MRI, and there's really no nerve damage. So we don't really know why. Now it's more my groin, kind of, so it might have something to do with my hip. As some of you know, I ran for years and did all kinds of things, associated with weight loss and with, a healthy lifestyle. Go figure. So, I don't know where that's coming from. So, but we know, and so I was kind of worried about what was going to happen with the plastic surgery. If in fact my numbers weren't okay, they are. Everything's fine. I went back because you have to have a physical 2 weeks before surgery in order, to have it. And all my numbers were perfectly fine. And so tomorrow morning, it's scary. Why is it scary? Well, this is it. I don't really plan on having anything else done. I won't even go into what my thighs look like, but that's okay. I can hide it well. But with my arms, I just feel like, with clothes, even with short sleeves, and I did take pictures, but I have little old lady arms. So anyhow, how does it feel? I mean, I have a lot of fears about regain. I have fears because it happened to me already once. It happened to me that, I lost 100 pounds and had plastics and then gained it back and lost it back. And I think that's a normal reaction if you've had that experience. I continue to see my therapist and I talk about it. What's interesting about maintenance and all habits that's happened to me, this is, after a year almost of not having, I want to say not struggling, but I do. I struggle at times with overeating or what to eat. But what I've noticed is that because of this surgery, I really need to increase my protein. And I do protein drinks. I eat a lot of salmon and beef. I'm a beef eater. I'm a very happy beef eater. I was born and raised in Argentina, So, and all of a sudden, like maybe the last week, I noticed that I started to eat nuts. And it wasn't what I ate or the amount of calories, because I don't do that. I don't check calories. I don't keep track. I pretty much look at how I feel about my food and my eating. And, as you all know, I went to treatment for an eating disorder, for binge eating. So I don't really look at my scale as a tool of telling me how I'm doing with my eating. I look at my behavior and how I feel about the eating. And all of a sudden, I started to sort of feel like I'm mindlessly eating. I'm eating nuts, and when I'm sort of done with a package, then I feel like I overate. Like the restriction. How you feel that you have that pain. I have that pain, that weird sensation that I overate. So I've really had to go back and sort of rethink that. Am I eating out of anxiety, which is would be common, would be that would make sense, but I'm trying to deal with, I'm feeling anxious because I'm going to have this surgery, and not, I'm anxious about overeating. So I think I've said that all along in my videos, how my goal and how I look at my eating disorder is about how it feels, and how my way of dealing with unpleasant feelings is to overeat, and then I can think about the overeating and how I feel about the overeating, or my weight, or what it's doing, and then not deal with what I'm really feeling. My mom was here for almost 2 weeks, and she comes for Thanksgiving, and last year, of course, I was in the process. I had just started at the university, and I was, 224 pounds, and dealing with I had to lose, 10 pounds. That's what the program, and it was interesting, if it's not one thing, it's your mom. It was interesting, and for us, because of course now, her seeing me and our relationship with dieting has always been an interesting part of our relationship. And so now, either saying I'm too thin or what are you eating? And she got to the point where she said, I know. How do you feel? Not how much you're eating. Because I kept saying, Mom, it's not about the size. It's not have I lost enough. It's, it's how I feel. How is my relationship with food? And we were able to go and see my therapist 3 times. So she was here for 2 weeks, and it was great. But, you can't, she's 86, and this has been a big part of our relationship. So I think she's tried really hard, and I give her so much credit for that. But it's hard. It's hard to explain to anyone that it's not about the scale. It's not how, and you can't stop it. You can't just say, oh, I'm going to stop, I'm going to stop losing today. I've had enough, your body's going to do what it needs to do. So that's where we are. And to say, oh, the last month, I've only lost 1.2 pounds or 2.1 pound, whatever, how many it is, it's hard for someone who hasn't had the experience or hasn't had the education about weight loss surgery to understand. And so that's where we are. So that's where I am. Tomorrow is a big day. It's a big day. My husband, went through the tummy tuck and the breast reduction 15 years ago. I think that he has a difficult time with why do you want to, cut yourself up? But he also knows me well enough after 22 years that it's about my decisions, and that's how I am, and he's very supportive. So my plan is I haven't done Insta stories yet. I'm afraid of them, but I'm going to try really hard to do them. If you're watching, listening, if you have any suggestions on how to go about it, let me know. I know how helpful when other people have made those, and Voodoo Queen and VSG Confessional, and others who now I can't think of her name, who just came back from Mexico. They were so helpful that I want to do the same for the community, and so I'm hoping that I can do it. I'm going to do my best. And everyone, we're in this together. Be safe. Have a good month, and take care of yourselves. And that's it. We'll see you soon. Thank you. Ciao. Besos.